Second thing I'd like to talk about is staffing. That is a conversation of the day. It's happening all across the country. You all have seen the numbers go up in our hospitalization rate. Both acute care beds are being filled up, as are ICU beds. The question becomes, how do we expand our capacity at the hospitals? When might we open the alternate care facility to take care of those overflows? The issue is not with the facility, it's with available staffing. Now, early in the pandemic, the way we handled this in places like New York and other areas that were seeing a peak were that traveling nurses, contracted staffing agencies, and others could come to the aid of any one municipality that was seeing a peak. That was the model that was put into place when the alternate care facility was envisioned way back in the spring. Unfortunately, that model is not going to work for us now because our entire nation is at a peak. And so we are left with the staff that we have here locally. We may get one or two people who break free from another locality to come here, but largely we are fighting this fight with the people that we have here in Memphis and Shelby County and in Tennessee. And so my message for you today is that we need you. We need you to join the fight. If you are a licensed medical provider in any domain, we would like you to step forward and sign up to the to the Medical Reserve Corps for the state of Tennessee. There are both paid and unpaid positions. That is a formal way in which we can get you engaged in the fight and put you at the right place at the right time. If you are someone who is interested in helping, but don't have any kind of a medical background, we need you as well. Today, there are far too many people with medical training who are doing administrative tasks. You've seen some articles in the paper about us even engaging medical students, nursing students, pharmacology students, and technical students to give immunizations. I call that force multipliers. Those are people filling the gap today, filling roles where medically trained people, medically certified people are used to give immunizations so that we can use those medically trained people in other roles to take care of patients. Similarly, if you have administrative skills and would like to volunteer, we can use you too. The last thing we need is for medically certified people to be doing any kind of logistics or administrative work. We can use you to help alleviate the burden so that we can better expand our capacity to serve patients who are in critical need of our care. The last message I will give to you is, please get tested, know your status, and if you are positive, isolate so that we never have to activate this alternate workforce because our hospitals are over capacity. With that, I'll turn it over to Dr. Randolph for some data.